Yeah, that's right, Steve. Anna Stein helping launch the new initiative Unshame NC this morning, which is seeking to promote awareness about substance use disorder, to end the stigma around it, and promote medications for it. And that's exactly what these new mobile clinics are trying to provide. And it's care that former addicts call truly life-changing.
I knew the first time I used that everything about my life would change or I would die.
Megan Peavy knows as well as anyone what it takes to beat an addiction to opioids.
It was disheartening and confusing to know that I just wanted to get well and I just wanted to be better and I didn't want to die, and people were still telling me that it wasn't okay or it wasn't enough.
The longtime Raleigh resident first started using opioids around 2012 before spending the next several years in and out of prison. In 2019, in the very room we met with her tonight here at the Morse Clinic in North Raleigh, she started her path to sobriety, taking her from the lowest of lows to a seat on an addiction treatment panel alongside First Lady Anna Stein.
To be a part of the solution and to be able to share my experience with people who may not know that this is what substance use disorder looks like. It just is, and we get to be a part of the solution and have a voice. It's pretty amazing.
Megan says ease of access to opioid treatment medication like methadone can make all the difference. That's what Dr. Eric Morse is trying to improve with his new mobile clinic in Wake County.
We're pretty much able to make sure that people aren't paying for treatment anymore. It's free. But transportation is now the #1 barrier to getting into treatment.
Morse has run brick-and-mortar opioid treatment clinics in the Triangle since 2010. The goal, get people easy access to medication, minus the stigma, and a safe space to take their supervised dose. About 2 weeks ago, he launched his first mobile clinic at Healing Transitions in Raleigh, with a second set to provide service in Granville and Franklin counties this fall. It's a drastic change from where the conversation was when his first clinic opened 15 years ago.
We were kind of working in the shadows, we were in silos, and now, partly because it is an epidemic, we've been brought to light.
The mobile clinic that's already in service picks up medication and staff from a physical location here in Raleigh before driving to Healing Transitions, which is a nonprofit recovery center in the city. Moore said they've already had 49 admissions, which far exceeds his expectations. They're expecting to add more stops here in the city, so you may see that van around here a little bit more in the coming months. Lauren?